Good evening, everybody. I would like to first start by thanking the organizers for inviting me to share with you this presentation. These are my disclosures. And over the next few minutes, I will share with you some data on obesity as a global problem, obesity in Africa, and some specific data from Egypt from the screening program that we had 2 years ago. The WHO states that worldwide obesity has tripled since 2017. And in 2016, almost 40% of the adult population were obese or were overweight or obese, 1.9 billion. And of these, 650 million were obese. And this graph shows the trend of obesity in the different WHO regions. It has been increasing in all WHO regions, especially in the Eastern Mediterranean and the Americas. But even in Africa and Southeast Asia, where obesity was very, very low, it has been on the increase. In Africa, the problem of obesity is also increasing. In almost all countries in Africa, obesity is on the increase. However, in most countries, the prevalence of obesity is less than the global average. Obesity is higher in prevalence only in the countries in North Africa and in South Africa as a country. And the following video will show the increasing trend of obesity in Africa since 1975. And as you can see, obesity is highest in Egypt and Libya, and above 25% in the rest of North Africa and South Africa. In Egypt in 2018, we started a national screening program, mainly aimed at eliminating hepatitis C. We screened 50 million adults over a 7-month period. We identified 2.4 million with hepatitis C, and we treated 1.6 million who were viremic. And in this program, we measured the weight and the height and blood glucose and blood pressure for all the participants. And we have a detailed analysis of the weight composition of the 50 million in the population. The total weight was more than 4 million tons. And we have a detailed BMI calculation. And the BMI has increased tremendously over the years. And now it stands at 28.7 for males and 32.5 for females in average. And this has increased a lot since 1975. These two bar charts show the prevalence of different weight classes in females and males. Overweight and obesity is 74% overall, 80% in females and 68% in males. And obesity is 40% overall, 50% in males, and almost 30% in females, and almost 30% in males. This table and graph show the different classes of obesity, and in females, all classes of obesity were higher than in males significantly in all classes. This table shows the age prevalence. It's increasing with age, both in males and females. However, in females, it is higher, significantly higher than males in all age groups. And these graphs represent the findings in the table of the 50 million adults that were screened, 25 million females and 24 million males. Over the years, obesity in Egypt has increased since '92. It has almost doubled in females, reaching more than 50%, and almost more than tripled in males, reaching 30%. And the two graphs on the right show that normal weight in females has decreased from close to 60% to less than 20. And in males, it has decreased from almost 70% to less than 40%. So it's an increasing problem. And we were able to draw a detailed geographic distribution of the prevalence of obesity up to the neighborhood level. So we know each neighborhood in Egypt now. This is the distribution of obesity in males geographically and in females. In Egypt, obesity is centered in the Nile Delta and in the desert communities. Global ranking, the highest prevalence of obesity worldwide is in the small Pacific Island countries, which have very low population. However, the highest country in obesity is Kuwait, and Egypt ranks 4th globally overall and the #1 country in female obesity. And this table shows the distribution of overweight and obesity in different countries ranked by prevalence of obesity. And as you can see, Egypt ranks #1 in female obesity and #4 in overall obesity. Regarding non-alcoholic fatty liver disease or NAFLD, the global prevalence almost mirrors the prevalence of obesity. And in this global map, we can see that in Egypt, NAFLD is above 30% or among the highest in the world. And we have very little data about NAFLD in the general population in Egypt. However, there were 2 studies in adolescents and young people. In the first study, NAFLD was evaluated by ultrasound, and 42% of the adolescents were obese. And among the obese, 80% had non-alcoholic fatty liver disease, compared to 40% of the non-obese. In the second trial, steatosis or NAFLD was evaluated by CAP score, controlled attenuation parameter by FibroScan. And NAFLD was present in 47.5% of the young adults, and the fat content in the liver increased with increasing weight, as you can see from this bar chart. We have data for 271,000 patients with hepatitis C. The prevalence of overweight and obesity in these patients was 77%, which is similar to the general population. However, those who had non-alcoholic fatty liver disease among these patients, 117,000 or 43%, the prevalence of overweight and obesity was 94%. So it's much higher than the prevalence in the general population. So being overweight or obese increases the chance of having fatty liver disease even in patients with hepatitis C. So in conclusion, obesity is increasing as a global trend. In Egypt, we have the largest population weight screening in history. More than 50 million adults were evaluated. Obesity and overweight are increasing in both males and females. In females, #1, we currently stand as the highest prevalence of obesity in the world. 95% of patients with fatty liver disease are either obese or overweight. And it's becoming a major health problem and a major liver disease problem in Egypt specifically and globally. And thank you very much for your attention.